Good evening.
I'm presenting regarding the low flow anesthesia. Low flow anesthesia is a technique which uses fresh gas flows less than the normal minute ventilation. The Baker's classification is metabolic flow is less than 250 ml per minute, and the minimal flow is 250 to 500 ml per minute, and the low flow anesthesia is 500 to 1000 ml per minute, and medium flow is 1 to 2 liter per minute, and high flow is more than 2 liter per minute. Disadvantages of high fresh gas flows are there are more anesthetic gas drug being delivered than being uptake into the tissues, and more than 80% of the delivered volatile anesthetic is wasted. And regarding the advantages of low flow anesthesia, it is physiological, which preserves the heat and humidity of the inspired gas. It improves the flow dynamics of the inhaled anesthetics, and mucociliary clearance is preserved, and it reduces the accumulation of the dried airway secretions. And second one is economical. Low flow anesthesia reduces the anesthetic gas consumption, and it causes significant savings of the order of 60 to 75% with regard to volatile anesthetic agents. And it is ecological, which is reduced overflow of the volatile agents and nitrous oxide, which damages the Earth's ozone layer, and it causes reduced greenhouse effect. And environmental, and which reduces the operating room theater pollution due to less exposure to anesthetic gas vapors. And regarding the rebreathing of expired gases, and in low flow anesthesia, it percentage of rebreathing is 86%, and in high flow it is 0%, and in closed circuit there is 100% rebreathing. And the different methods of low flow anesthesia are it can be delivered via semi-closed rebreathing system and a closed rebreathing system. And in semi-closed rebreathing system, the low flow is up to 1 liter per minute, and minimal flow is fresh gas flow up to 0.5 liter per minute. And in closed rebreathing system, there are two types: a closed system and quantitative closed system. Closed system is a constant, it is providing a constant gas volume. That is, the fresh gas flow is the gas volume taken up by the patient. And in quantitative closed system anesthesia, constant gas volume and composition of the anesthetic gases, that is, the fresh gas flow is the volume of the oxygen, nitrous oxide, and inhalational anesthetic agent. And regarding the requirements of low flow anesthesia, there should be a gas monitoring system providing the inspired and end-tidal concentration of the agents, and flow meters which flows down to 50 ml per minute, and there should be a leak-proof circle breathing systems and airway devices, and there should be a vaporizers capable of delivering high concentrations and calibrated to be accurate at low fresh gas flows. And there should be a minimal reserve volume for the breathing system. And the leakaging rate of rebreathing system should not exceed 100 ml per minute. And there should be anesthetic gas reservoir, and there should be a fresh gas flow compensation or anesthetic ventilator, and vaporizers and pressure and temperature flow compensated, all the types should be updated. And regarding the disadvantages of low flow anesthesia, it leads to slower induction and emergence from anesthesia, and there will be a higher consumption of carbon dioxide reabsorbance, and in poorer areas where there are no resources, it is a disadvantage. And accumulation of undesirable trace gases like compound A and carbon monoxide, which can be harmful. And there is a longer time for gas concentration to change in the breathing circuit. So that's all, sir.
Sure.
Second topic.
Hmm.
Second topic is